Welcome to the Healthy Careers Podcast, where we help healthcare providers succeed on purpose. We take a conversational approach in learning from others who have been there and done that. Join us as we share expert insights from real people who are just like you, because we believe that success isn't just a destination. It's an intentional journey, and you don't have to do it alone.
Welcome back to the Healthy Careers Podcast. I'm your host, Madison Loomis, and today I have somebody that is actually a personal friend of mine. So not somebody that I met on a LinkedIn connection, which is great. So we're going to talk a little bit about his background. He's an orthopedic trauma surgeon. He's in residency right now, and he's had not a super wild approach or journey to where he's at, but he has done things a little bit differently. So I'm excited to share that with you all and talk a little bit more about the mental fortitude in deciding to go to school for the next 10, 11, 12, 13 years before really getting to your career. So welcome to the podcast, Dustin.
Thank you for having me.
Yeah, of course. Awesome. So tell us a little bit about you, where you started with things, your roots here in West Georgia, and where you're at right now.
Yeah, so originally we're probably an hour west of Atlanta, more or less middle of nowhere, Georgia. So graduated high school there, went to college there, got a degree in biochemistry. Actually started out thinking I was going to do nursing. So started out with that in mind, ended up getting my degree in biochemistry. I was working for an orthopedic office, and they, after working there for a little while, the surgeons kind of convinced me that being a doctor was more fun than being a nurse. And I don't disagree.
Yeah.
Now that I'm finally on this side of things.
Wait, aren't you married to a nurse though?
Had a few twists and
or you're marrying
she does
a nurse.
CT, so she's
CT,
actually a
okay.
CT tech. Yeah.
I was gonna say that's pretty classic though.
Yeah. So I had a few twists and turns along the way. I actually did 2 years of my medical school in the Caribbean, and then transferred to a school back in Georgia. So ended up graduating from a U.S. medical school.
Why did you choose to do that?
Well, medical school is ever more competitive to get into. And generally speaking, people that don't get in once or twice to U.S. medical schools or U.S. allopathic medical schools, there's two options. You could either go to a DO school or go to a school in the Caribbean. I chose to go to a school in the Caribbean. Whether that was the right choice or not, I don't know, but it worked out for me. Granted, it is exceedingly difficult to get into orthopedic surgery if you do graduate from a Caribbean medical school. So knowing that, I made the decision to do my first 2 years there. So my first the didactic years of medical school in the Caribbean. And then I was fortunate enough to transfer to a U.S. medical school and graduate from the U.S. medical school.
Awesome.
So it worked out for me, but that is certainly not a common path.
No, it's not. I didn't even know that was a thing, but I mean, I think, and that's what I mean by non-traditional, and that I'm sure you saw the differences between how medicine is practiced and also taught in the two different countries. I mean, there's a reason why the U.S. is known as, the go-to spot for healthcare and top surgeons and doctors.
Yes, exactly. So after medical school, though, I it's more and more common now to not match on your first time around going into orthopedics. And so I was one of those that fell through the cracks on the first time around. So I did a preliminary year in general surgery and was fortunate to match on the second time around. And now I will be graduating this year and heading to trauma fellowship. So it's exciting times.
Yeah. And what made you make that shift from... Because, I mean, orthopedics is so broad, right? You can go into specializing in hand. You can become trauma. You can go into, hip and knee. You can go into somebody that just does upper extremities. So for you, what made you pick the trauma side of things? Because, I mean, that's super intense and not just your regular physician role.
That's very true. I had a few influences in that. My general surgery year, it was in a very trauma-heavy program, and I did I was at least somewhat involved in the trauma rotation for probably half that year, whether that
Okay.
was on orthopedics or with the general surgery. And I enjoyed it. Then we are relatively trauma heavy in Buffalo as well.
Yeah.
So you end up seeing these people, they come to you on the worst day of their life sometimes, and it's only better from there for the vast majority of them. So, it's not your pro athlete coming to you saying, my toe hurts, I have to miss 2 games, and then if they miss a third
Yeah.
game, then they're mad at you because you told them they'd only
Yeah.
be out for 2. It's the people with big injuries, real injuries, and you can make a significant impact on them,
That's very true.
and turn around their life sometimes.
Yeah. And I mean, I've always wondered too. I can't even get my blood taken without, crying pretty much, fainting. So for me, I could never get into a surgical subspecialty, but I've heard that there is, that fight or flight response when you're in those situations. And I'm curious to know, like, how long did it take you to get used to that, to where that was just kind of like second nature to you, to be able to deal with something where you're like, oh my gosh, like, okay, this guy's coming in with X, Y, and Z, and we've got to be the ones to fix it. I mean, I would just freeze up, and I feel like that's not something that just naturally kicks in for somebody.
That's very true. You work in a trauma setting and you're in the trauma bay. There are at least 50 things happening all at once. There's, depending on what's going on, any number of patient or people surrounding the patient. You may have 2 nurses getting an IV on each arm. You may have someone else, putting in a chest tube, someone else stabilizing the cervical collar, somebody else intubating. So you're right. Those are very intense
Yeah.
scenarios. And as long as you know your role, then it's easier to help out. And that role changes over time too. As a medical student, you may talk to EMS, get the history, that kind of thing. So you kind of find your roles are pretty well defined on a trauma team. That's how they work efficiently and effectively, but they change over time. And every one of them is important. Know your role going into it, and
Yeah.
that certainly helps out a lot.
And I would imagine too, after a while, it's kind of like you're shocked by your ability to handle it and not be stressed out by it, Because I think that's
Right.
the ultimate thing of what makes a good surgeon, is somebody that in a super intense situation can sit there and go, okay, hand me the this, hand me the that. Like you see in Grey's Anatomy, and I'm like, oh my gosh, I would be like crying, like, are you okay? What do I do?
That's why surgical training is
Yeah.
at least 5 years. For most of
Yeah.
us, it's at minimum 5 years, and that's if you don't do a fellowship, you don't do another intern year, you don't do a research year. So it's minimum 5 years, and
Yeah.
it truly takes that long to be comfortable in the majority of it, and progress through that training.
Yeah. And how do you, I guess, because I've seen a lot around more recently when you talk about burnout, and I think it ties into it somewhat, is all day, every day you are dealing with everybody's worst day, like you said, right? Like when they see you, it's their worst day, hands down. So, and you have a young family, and there's a lot to balance there with work and the emotions. Like, how have you learned to be able to kind of separate the two things? Because I would imagine it can get heavy for you from an emotional standpoint.
That's a challenge, and I think everyone handles it a little bit differently. As far as separating work and family, that's also difficult, because to be a surgeon, you spend probably more time out of your day and out of your everyday life at work than you do at home.
Yeah.
So you take advantage of those few, the brief periods you do get at home, and you try to be there in the moment and take advantage of that. But to your point, as far as how do you handle all the grief, the trauma, the
Yeah.
bad things that happen around you? I think it depends on how you look at it. For me, I look at it as, yes, like this person right now in front of me is doing absolutely horrendous, but I know that if we can get them stabilized and we can do everything we can for them, then they're most likely going to have a decent outcome.
Right.
And so keeping that in mind, and going to see the patients on the floor after surgery, not, you do the surgery, everybody, their legs lined up again, you high five, and that's surgery is obviously the fun part for us. That's what we love to do most. But seeing the
Yeah.
people 3 months, 6 months, a year later, and they're back to work, they're playing with their kids. They hopefully aren't back on their motorcycle, but that's a lot of them's goal.
Yeah. Motorcycle accidents, my gosh. I lost a friend actually, or somebody that I knew from the gym. He wasn't a close friend of mine, but he got hit. He was on his motorcycle, and it's like there's those instances too where I'm sure you have people come in and you can fix them, and then something else goes awry that you didn't know about or whatever, and it's just tough. I think that's what I would struggle with the most if I was ever smart enough to be a surgeon. But I guess similar to that, with the sense of delayed gratification, I think you see that as a surgeon too, because a lot of times the outcome, like you said, you could fix a leg, you could fix a knee, whatever, and then you see them after, and then 3 weeks later you're able to see them post, therapy, everything else, and rehab, and you see the outcomes. But from the standpoint of your career, I mean, you got into medicine and got into your position now knowing it was going to be, I think you mentioned 12 or 13 years by the time that you're out looking for a job within your specialization. So how do you wrap your head around that? I'm the world's most impatient person in the world. So for me, like, I don't know how you would sit there and say, okay, 13 years from now, I'll do that. And I'm going to work for it until that point.
I think that's the irony of surgeons in general, because we have the longest training of any other medical professional. And
Yeah.
we do that so we can have immediate gratification. Surgery is the most, one of the most immediate gratifying specialties you can do.
Yeah.
But we train forever and ever to do it. Fortunately, it is broken up into blocks or stepping stones. So you have something to look forward to at every step of the way. So,
Right.
You do undergrad and you say, okay, well, it's only 4 years of medical school. And then it's only 5 years of residency. And then it's only 1 year of fellowship. So when you think about it that way, it helps. There's individual, or there's shorter term goals in sight than the big picture. And there's, gratifying aspects of all of those along the way. So that was how I did it. I started medical school. I said, okay, in 2 years, I know I'm going to need to transfer, and I'll be on to a different place and a little bit of a different adventure. 2 years later, I'll be looking for residency, and then within residency, your junior years, your first, second, sometimes third year, you tend to do a little bit more of the, I guess, less fun task, but depending on your residency, you still get to have some fun in the operating room. We're fortunate here in Buffalo. We do get in the operating room pretty much as soon as we start. So
Great.
That's ideal. But then your training changes over the years too, as you get more experience, so at this point, I'm expected to be able to do the vast majority of cases I'm in, and hopefully the attending shouldn't have to be there. They are, of course, but they shouldn't have to be. So going through that transition over the years is, as it's all finally starting to come together, is nice.
Yeah. And did you have at any point like imposter syndrome, if you will, or what was the biggest challenge for you in all of that? Because, I mean, you have to really trust yourself also and have confidence that I can do this, right? Whether the attending's here or not, I mean, this is going to be my job, so I've got to learn how to do it autonomously, or at least with the team without the attending at some point. So, like, what was that biggest challenge for you?
That's actually interesting, and something that's being looked at more and more now, and specifically in surgery and orthopedics, is the spectrum of imposter syndrome on one end and overconfidence on the other. And most of us fall somewhere on that spectrum, and maybe to some degree, we're a little bit of both at times in different scenarios. So I was at a leadership conference and we talked about this, and I hadn't even considered myself as having imposter syndrome. It's, I'd heard of it, but I didn't really give it
Label
any thought. And we started going through it, and I was like, I can identify with some of this. So I've certainly experienced that. You hear, hey, you did great on that case. And you're like, yeah, but I missed this step or that step, or I didn't prep it right, or, my positioning was just a little bit off. My reduction could have been this much, 2 millimeters better. And it's these little things you beat yourself up about. But even though everything went wonderful, according to
Right.
your attending that's with you or whoever else. So I certainly identify with that. It varies, in more uncomfortable situations or something that should be more routine. I may have a little bit different experience with each one of those, but there's some thought that maybe a little bit of imposter syndrome is a good thing. It keeps you humble.
Yeah.
It keeps you wanting to get better. Too much of it can obviously be paralyzing. You're like, I can't imagine trying to get over this, even though you are technically doing a good job.
Yeah, I know. I think there's some people that have like that analysis paralysis of it of, oh, I could have done this better, I could have done that better. And in medicine, that's one area where I would argue you don't want to be too far from perfect, right? But is there perfect in science? I don't know, right? Like if you're solving a problem and you're fixing what was broken, if it was 2 millimeters, as you were saying, away, like, is it really that much of a difference when you look at the outcomes of them going back to whatever they do, were doing? Then probably not, right? And that's where I think sometimes type A people, which a lot of people that are in medicine and surgery are type A, and they beat themselves up over that. And then it's like, no, you did it, right? You've got the confidence. And the more that you do it, the more routine it becomes, even the more difficult things that at the start were just like, I don't even know where to start,
Right. There's a saying, you may have heard it, but the enemy of good is perfect. And that's, I certainly feel that early on, even this year. So my chief year, it was hard for me to accept that if something's just a little bit off, it's still okay.
Yeah.
And, we, not all of us, but a lot of us tend to be perfectionists or OCD or however you want to describe that. But knowing when good is good enough and you're going to have a good outcome, and you spending more time to make something that's really trivial and honestly doesn't affect the outcome may not be the right thing to do.
Yeah. Yeah. And I want to talk about something that's kind of off the rails, and we talked about it a little bit, but didn't really get into the weeds of it. But I bet there's a lot of people listening who I've talked, and I don't want to come across as demeaning about this, because there's nothing wrong with people that choose the other option. But, when people are interested in medicine and they start to think about how many years do I want to go to school, right? Or where do I see myself in the healthcare ecosystem? And a big problem that I hear from PAs or NPs is that it's like, oh, people ask them, when are you going back to medical school to become a doctor? And it's like, oh no, like I'm not. This is what I chose to do instead of, but replacing that instead of like, no, I chose to be a PA to be a PA, or I chose to be an orthopedic surgeon and become an orthopedic surgeon. But I found that younger surgeons tend to see how APPs fit into that system and team more so than people that maybe haven't utilized them their entire career. But I'm just curious from your standpoint, because you are in a position where you're going to be an orthopedic trauma surgeon. Like, did you ever have that time, I guess, where you didn't know what you wanted to do, and then you decided, no, I want to go the full route and take the 13 years to do it?
Yeah, that was actually that did fall in my decision-making tree at some point. In my gap year between undergrad and medical school, I was, thinking of all of my options. In my brain, I had 4 options. One, I could go to a Caribbean medical school, and those tend to be allopathic schools. You get an MD. I could go to a DO school in the U.S., or I could change paths slightly and go into PA school. And then the 4th option, which is one that I wasn't much of a fan of, was to do something completely different and unrelated to medicine. So that was kind of where I stood as far as where was I going to go during my gap year. At some point you say, okay, if I didn't get in, then what are my options if I don't get in again? So, and then the other side of that is trying to figure out why someone may choose to do PA school or become an NP, or I think those are a little bit different though.
Yeah, I would say the
I
biggest
think
one is
PAs
the
and
cost of
NPs are a little bit of a
schooling.
different pathway.
Yeah.
So, NPs, you go to nursing school, and then once you finish nursing school, you can be a nurse for the rest of your life, and some people are perfectly happy with that.
Mm-hmm.
You could go on to get a different advanced degree. You could go into anesthesia. You could go into NP school. You
Mm-hmm.
could do first assist, critical care. You can be a flight nurse. You can do all these other things. So nursing leaves that pathway open. Certainly, if you're not sure exactly how you want to
Right.
go. PAs, I feel like, at least when I was looking into this, probably 10 years ago now, if I remember correctly, part of the thing that kept me from going or considering PA school more strongly at the time was that most PA schools, they were not a fan of you coming to PA school if you were coming because you didn't get into medical school. They really wanted
Mm.
people that were truly interested in being a PA. That could have
Right.
changed, but that seemed to be my experience and kind of what I gathered. I was going to have to take, I want to say, three more semesters of classes to get these random things that didn't really fit into most pre-med curriculum.
Sure.
And so I think that was one way they kind of weeded out some of those people.
Yeah.
And that
Sure.
was my perception of it. Maybe that's not true.
No, I mean, I think there's a few different reasons why someone would either decide to go and become an orthopedic surgeon or a surgeon versus that of an NP. I think there's also a lot of reasons why people choose to become an NP over a PA when you look at the autonomy that they're given in certain states, and prescriptive authority, all of that kind of stuff. But at the same time, I think for PAs, I've heard, at least from some of my friends, is it's like the money and the concept of that mental fortitude of, I'm not going to be working in the job autonomously doing what I want to do for the next 13 years if you're going and doing a fellowship, versus you can become a PA in 2 or 6 years if you want to include undergrad, and I think there's a lot to be said for that. And it doesn't take away from what they do or their importance in the whole team. But I also think that money is another huge part of it too. I mean, people that are looking down the barrel of school for 13 years, like, that comes at a cost. I mean, I'm sure you're feeling it now, where it's like during that time, you're not paid as a surgeon until you're out doing that job. And a lot of times you're also working double the amount of hours to get to that point. And so I think that takes an extreme amount of just mental strength to be able to grind through that. I mean, I personally know myself well enough that I wouldn't be able to. So I'd love to hear your take on that, because I mean, it's just amazing to me that people can just hunker down for that long.
That's 100% true. And for me, it was more in in my mind. Of course, I knew how long it would take to get through medical school, to get through residency, and then eventually become an attending. But when you actually come down to it, have to live it, it's it certainly it feels like it's much longer, and shorter at the same time. If that makes any sense, it goes by fast, but at the same time, you feel like, oh yeah, this has actually been a long time. Not to mention, medical school is expensive. Particularly mine, both were private medical schools, and then same thing. I think all of the DO schools are private medical schools, and they're even more expensive than the state schools.
Yeah.
I want to say 70-80% of people graduating from medical school have student loans, and I want to say the average student loan is between $200,000 and $250,000. So it's not
Yeah.
cheap, and
No,
that's
that's
scary
not.
for a lot of people.
Especially, I mean, for you, you'll be set, right? Because you're going into a specialty, and I think that's why a lot of people, while we have a disparity of primary care physicians in the U.S. in general, but it's like the cost of school is so high that unless you specialize, unless you do fellowships, it's going to take you X amount longer to pay off your student loans and actually be able to have profit year over year in what you're doing, what you studied for. So it's like also tacking that on to the fact that like, oh, even after the 13 years, if I'm, a primary care physician and say you're making $200,000 a year, well, okay, so then another year, and that's not counting living expenses. So it's going to take me X amount of years to pay off on top of that. So it's just, I feel like it's the biggest issue in our healthcare system is the schooling and how expensive it is. But yeah, it's.
I think that I certainly think that contributes to some of the specialty choices people make. For me, I knew I wanted to go into orthopedics before I came to medical school. My mind was already made up. But if you look at the salary charts at orthopedics, plastic surgery, cardiothoracic, neurosurgery, they do tend to be at the top of the list. You do have longer training, and we work a lot of hours. Also, we don't have a 9-to-5 job. We have sometimes 24, 36-hour calls, especially as an attending. Sometimes it's full weekend call, so that salary doesn't come, with the average, with the average 40-hour work week.
No. Yeah.
But to your point that, primary cares, they tend to fall in the lower end of that spectrum. And when you're looking at a salary that sometimes is about as much as your loans are, that's intimidating. There are certain programs specifically for primary care physicians and nonprofit organizations where you can have your loans forgiven. So public service loan forgiveness is a program.
I've heard of that one.
Started, I think that started 10 years ago or maybe a little longer. So if you work for a nonprofit for 10 years, then your loans can be forgiven. And that's how some people, I guess, conceptualize it and fit that into their ultimate career and financial plan. But that's still not, that does limit you to some degree if you plan on doing that and to where you can get a job and what kind of organization you can work for.
I've seen a lot of people, probably more so at the APP level, struggle with that, getting out of school. And, they're like, I can only work with, a federally qualified health center, or I can only work with a nonprofit or one that is, qualified underneath that program. And I think it does limit you a bit, but there's trade-off, right? I mean, to be able to say, I know a PA that just had all of his student loans forgiven and he's good to go now. And he's been able to take sabbaticals and everything else. He was actually on the podcast. But I mean, I think that is one way to think about it, but it's also specializing can be beneficial, not just from the financial standpoint, but I find as a recruiter, right, I look at it from a branding standpoint of, you are specialized within this one thing. And if someone has this one problem, then they're coming to you, right? For your sake, it's on their worst day when their whole leg is, they got into a car accident and you need to repair it and fix it. That's not every single surgeon that you come across, and not everyone has the ability in that situation to stay, cool, calm, and collected and be able to pull that off. So I think that is like your brand, and that, hey, I can do that. And that's worth a lot of money, just the ability to have that mentality.
Right. And I want to say the numbers recently show that about 90 to 95% of orthopedic surgery residents are pursuing a fellowship in subspecialty practice. Part of that is, we're increasingly more subspecialized. There's, many, many options for implants and devices. And it takes a full extra year to learn all that and to have that designation of I am the total joint surgeon. I specialize in total joint revision arthroplasty. That's what I'm gonna do. But there's certainly still a role for generalist, particularly in underserved areas, and because that's the constant challenge you face is as we become more specialized, then are we marginalizing these other areas where we may be limiting access?
There's a huge discrepancy there, I find, with rural areas. I mean, I work with a Trauma One hospital over in California, and they're in an area that's not rural by any means, but even so, I mean, to get providers is more difficult because it's not Dallas, Texas. It's not New York City. It's not these huge areas, or you look at, Raleigh, or these areas that are near all the medical schools, Atlanta. I mean, Atlanta doesn't struggle finding anybody, but over where we live, yeah, sometimes it can be difficult to find specialty people as well as primary care physicians. And it's like a lot of the places around here utilize the method of, we've got a few MDs and 1,000,001 NPs handling most of the care for the patients, which is fine. But, I think it does create a huge disadvantage for people that are in rural areas who can't get the specialized care that they need. And personally, I feel like the way to fix that is the cost of education, because I think that's a lot of people's barrier to becoming surgeons or physicians. It's not because they're not smart enough. It's not because they won't put in the work, but they can't afford it, or they don't have the support system during that 13 years to say, I can still support myself and put myself through school and have all of that debt at the end of it.
It's certainly climbing. Education is not getting any cheaper in any field, not just medicine. That's across the board. So that's certainly one aspect of it is the climbing cost of education.
Now, I'm curious, was it cheaper to go to medical school in the Caribbean, or was it more expensive because you were out of the country?
Private medical schools in general are more expensive. So the majority, actually all of the Caribbean medical schools are private medical schools. Then, as far as I know, I could be mistaken, but a lot of the DO schools are also for profit. So they're private.
Okay.
They're not state funded.
Right.
Those tend to be more expensive. There are certainly exceptions. But yes, and then when I transferred, the U.S. medical school I went to was also a private medical school. So that was also expensive. So mine is probably I have more than average student loans.
But that's all right, because you're going into something that's going to make more than average, right? I mean, that's how you got to look at it is,
right.
If I were going to become a primary care physician, then I'd probably stay the route of going to the public places and going to a program where I could get some loans forgiven or whatever else, because I knew that I'm not going to be making $500,000, $600,000 post-graduation or fellowship or whatever. I guess you don't need a fellowship for primary care, but you know what I mean.
Right. Exactly.
Awesome.
Those things certainly play into a lot of people's specialty choice. So
definitely
can't be ignored.
No. Awesome. Well, I've appreciated the conversation. I mean, I think there's a lot to learn in terms of that mentality of being able to stick something out. I think what you said stood out to me about, you spend all of that time for delayed gratification for instant gratification. Like, you train for the fact that at some point you're going to be able to see that like residual value of what you've done right then and there, which there's not many jobs like that. Like my job, one of my biggest complaints is that I never really get to see the true impact of what I'm doing because I'm the middleman, right? So if I hire you and I connect you to a hospital system, you might go off and you're going to do great things. I might hear about it. I don't know what the numbers look like in terms of what you're producing for the hospital. I don't know the patient that, you saved their life, or I don't know the family that you said, I don't get to experience any of that like you do, right? Firsthand patient outcomes, experience everything else. And I think that is the one beauty in medicine, is that you truly are at the forefront of impacting these people every single day. And sometimes those outcomes are not great, but most of the time, you're able to do something to where you can go home and sleep at night knowing like, wow, I just did a lot of good in the world.
Sure. And that's what makes everything worth it.
Yeah, definitely. Awesome. Cool. Well, we will hopefully do another podcast once Dustin is swinging in his full-time job, which will be 2 years from now, a year and a half from now.
That will be, 18 months-ish.
Okay.
Something like that. That'd be about right. That'll be
so
when
we'll have to
finally start my real attending job.
Yes. Perfect. Well, we'll have to have you back on the podcast then so that you can fill us in on the rest and maybe recommend some things for fellowship and all that. But appreciate your time and for sharing some insight on kind of the mindset and just the challenges that come along with becoming an orthopedic surgeon.
Sure. Thanks for having me on. It was a great discussion, I think.
Yeah. Awesome. Cool. Well, until next time, everyone.
Thanks for listening to the Healthy Careers Podcast, where we provide a platform for you to ask hard questions and get real answers. If you enjoyed this episode, don't forget to subscribe and share it with your friends. Stay tuned for more episodes every other Friday at 7 a.m. Eastern.